CalgarySinusCentre.ca.
Time now for Body and Balance means that health specialist Leah Sarich is joining us. Interesting topic today. 80,000 Calgarians are living with chronic sinusitis, which means they have stuffy noses all the time, and that means they're likely not sleeping well.
Exactly.
80,000 people.
Grumpy, unwell people. Isn't that amazing? 8% of the population.
No idea. I thought it would be that high.
You know, I didn't either. I mean, I knew it was quite common, but I didn't realize it was 8% of the population. So it's very, very common. So chronic sinusitis, let's talk about what this is. So it's an inflammatory condition of the sinuses and of the nose. So it's that lining that's getting inflamed. They don't really know why. They know that there's something triggering this reaction, this inflammatory reaction in the body. But it could be many, many things. So it could be allergies, it could be fungus, it could be bacteria, it could be viruses. They don't really know what's causing it, which makes it difficult to treat. So there's a lot of different things that they use to treat it. The standard treatment is medical therapy. So we're talking daily saline rinses, nasal sprays, oral steroids, antibiotics, all these kinds of things. So it's all of these things in combination that they have to do to treat it. So it's very complex. And people get, you know, really run down with this. So it's really affecting their quality of life. So, and what happens with a lot of those people is that if that doesn't work, that medical therapy, if it doesn't work, they're referred then to surgery.
Sure.
So that's a very, sort of a big surgery, if you will, because they're going in there and they're removing bone and tissue from that nasal area. Yeah, so it's pretty intense. So what we're looking at is a brand new therapy. It's a new treatment option, and it's called Balloon Sinuplasty. Very like an angioplasty in the heart. They basically put a catheter in there and open things up.
Oh, they expand it?
Yeah, they sure do.
Like a balloon, right?
Exactly, exactly. So Dr. Brad Mechor is going to explain how it works.
And with the balloon, what it'll do is it expands that opening, but it also moves the bones that are covering that out of the way. And so it causes little fractures of the bones over top of the opening, and then with time it will heal and let the sinus drain and ventilate properly. The nice thing about it is I can do it in my office. So if somebody has accessible anatomy, meaning they don't have a great deviation of their nasal septum, that I can actually see where the sinuses are opening, I can do it in my office under a local anesthetic. And it usually takes about 15 to 20 minutes. So what that does, it allows people to avoid going to the operating room, avoid a general anesthetic. And that's the most convenient thing. And then from that, people are back to normal function, usually within a day or two.
Which is pretty amazing when you think about it. So they're actually avoiding getting a general anesthetic. They're avoiding time in the hospital. It takes 15, 20 minutes in his office.
That's fast.
Yeah, it's really fast. And, you know, I spoke to a patient who had this done, and she, first of all, was an ideal patient.
Okay.
So that's the thing. You really want to be an ideal patient. So what is the ideal patient? The ideal patient is someone with early disease, so they've had it for a relatively short time.
Okay.
And minimal disease, so it's not too full-blown just yet. And the big thing here is that the patient is going to be someone who is going to be compliant with their medical therapy afterward. So really, what this procedure does is it really just opens that area up, that opening into the nasal cavity there, and it opens it up so that it allows that medical therapy to work better.
Okay, so the saline solutions,
exactly, and all the steroids
earlier.
So that's the ideal patient. So I spoke with Carol Rupchich. There she is in the pictures there, and she was plagued with headaches caused by sinusitis. So she had these really bad headaches. She had recurrent infections, which required numerous rounds of antibiotics, and you can imagine she never knew when she was going to get sick. So you know, she had to cancel flights and things like that. So it was really affecting her quality of life. She said that it always felt like she was breathing through thick cotton wool all of the time. But it was determined that she was actually a very good candidate for this procedure. So she had it done in the spring, and here's what she has to say.
It really worked. It was quite effective, and I haven't had an infection since, and haven't had to be prescribed antibiotics for my sinus, and it actually improved the quality of my life. So it's great.
It sure was, yeah, absolutely. She walked out of there and was like, "Oh my God, I can breathe." She said, and so she felt the results right away. Yeah, so it's pretty
awesome.
Yeah.
Okay.
So for more information, it's all on my blog.
On your blog.
Yeah.
You took the words right out of my mouth.
You bet.
Good stuff. BreakfastTelevision.ca is where you can find Leah's blog. Let's head back to Andrew Schultz now, and things are looking pretty good, Andy.
Pretty good today, warmer than yesterday.